This is See Jason Podcast. I'm Jill Krissberg from Ann and Robert H. Lurie Children's Hospital of Chicago, and I am here with Matt Kaufmann and Abanti Chaudhuri from Stanford University. We are excited to talk about our work evaluating racial and ethnic disparities in pediatric kidney transplant. Racial and ethnic disparities exist in pediatric kidney transplant, both for access to transplantation and for outcomes post-transplant. The 2014 Kidney Allocation System update was implemented with the objective that these disparities would improve, and we wanted to see if it did in fact move the needle towards equity. Matt, tell us what we found.
Our results first showed there was no worsening in equity in the time from initial activation on the transplant list to receiving a transplantation. We also found that after the policy change, the time on dialysis to transplant and the odds for delayed graft function were equitable across racial and ethnic groups. Thus, our data indicates that the change with the 2014 Kidney Allocation System, where pre-registration dialysis time has been added to the candidate's wait time, has helped improve access for children of color who received dialysis prior to transplantation, without compromising graft quality. Abanti, what does this mean for the kidney community moving forward?
While this is good news, we want to be clear. We have a long way to go to achieve equity in pediatric kidney transplantation. In unadjusted analysis, when we do not adjust for patient or transplant-related characteristics, there are still significant differences in time to transplant for Black, Hispanic, and other children of color. This might mean that children of color are still waiting longer for kidneys, possibly not because of something inherent about their race or ethnicity, but because of differences in disease severity, how sensitized they are, or where they live.
Thank you, Matt and Abanti, for that summary. The pediatric nephrology community needs to remain diligent in future transplant legislation to prevent vulnerable children from having increased barriers to transplantation. Thank you to See Jason Podcast for having us and highlighting our work.
This podcast is copyrighted by the American Society of Nephrology, all rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare provider if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.